Clinical pharmacy. Now we are going to discuss about the clinical pharmacy. Okay. Clinical pharmacy is the growing field of pharmacy where the clinical pharmacists are mainly responsible for the proving the service for patient care toward the use of medication and promote the health, well-being and prevention of disease. Clinical pharmacy is more patient oriented healthcare service. In these clinical pharmacists associated in taking care of patient in all health care setting which is initially began out inside hospital and clinics. Clinical pharmacist often works in collaboration with the physicians and nurses and practitioners as well as healthcare professionals. Clinical pharmacy contains a set of functions that includes promoting the safe, rational and effective use of medicines for individual patients. The clinical pharmacy practices involved specialized service which includes pharmaceutical care of patient through the complete medication history. Patient profile review, managing of adverse drug reactions, managing the drug information service and counseling, these are came under the clinical pharmacy. What is the history of clinical pharmacy? In 1953, the term clinical pharmacy was first time used. Clinical pharmacology concept was initiated in 1960 with two incidents. In 1961, thalidomide tragedy is found that birth of babies with sealed limb is occurred due to the consumption of popular sedative thalidomide. And another incident is in 1968 in Australia phenytoin toxicity was reported because of change in formulation, that is replacing the calcium sulfate with lactose as an inert excipient in the tablets. To investigate bioavailability, pharmacokinetics and toxicity of different formulations, these clinical pharmacy were invented. What is the difference between clinical pharmacy and pharmacy? Clinical pharmacy differs from the general pharmacy in terms of goals, which there is analysis of population needs with respect to medicine's way of drug administration, pattern of use and drug effects on the patients. In clinical pharmacy, attention moves from the drug to patient receiving the drugs, while the pharmacy mainly dealing with synthesis, chemistry and formulation of medicines. Goal of clinical pharmacy. What is the main goal of clinical pharmacy? The primary goal of clinical pharmacy is to promote the rational and appropriate use of medicines. The activities mainly aim to improving the clinical effect of medicines, minimizing the risk of treatment and adverse effects, minimizing the expenditures for pharmacological treatments. Clinical pharmacist requirements. What are the requirements that need to the clinical pharmacist? Some clinical pharmacists who are specially trained practitioners who deliver comprehensive medication for management and a direct patient care service. Clinical pharmacists work directly with physicians, other health professionals and patients to guarantee the work. The prescribed patients contribute towards the best possible health outcomes. Considering the important role of clinical pharmacist in patient healthcare service, it is essential to knowledge of drug therapy, knowledge of disease, knowledge of laboratory and diagnostic skills, should have to good communication skills to the pharmacist, should possess drug information skills, should have therapeutic planning skill, should have knowledge on non-drug therapy and physical assessment skill, patient monitoring skills. These are the skills which need to have a pharmacist who mainly worked in clinical pharmacy. Duties of clinical pharmacies. Clinical pharmacists play an important role in three different levels, that is, before prescription, during prescription, after prescription. In before prescription, involving in clinical trials, preparation of formularies, drug information service, designing of drug related policies. During the prescription, involved in counseling activity, involved in monitoring, detecting, preventing of problems, and clinical pharmacist give special attention to the dosage of drugs and need to explain the drug dosage to the patient and therapeutic monitoring also. After the prescription, pharmacist involved in patient counseling and preparation of personalized formulations and responsible for outcome research associated in pharmaco skills. What are the activities of functions of clinical pharmacist? The principal activities of clinical pharmacist includes patient medication history, profile patient review, adverse drug reaction management, therapeutic drug monitoring and drug information management, discharge patient counseling. First of all, patient medication history involves the correct collection of recording of information past and present medicines used by the patient. It is done during the patient interview and reviewing the past medical records. Profile patient review. In this patient profile review, the evaluation of patient and its medical chart is done by the clinical pharmacist. The components of patient profile review includes patient assessment, profile review and medication review. In adverse drug reaction management, it involves prevention, detection, management and reporting of the adverse drug reactions. The clinical pharmacist carries adverse drug reactions management with the help of patient counseling and patient profile review and history of the patient handling. The therapeutic drug monitoring, it includes clinical pharmacist dealing with the application of clinical pharmacokinetic for monitoring drug efficacy and toxicities. The drugs like gentamicin, amikacin, tobramycin, vancomycin, carbamazepine, phenytoin, valproic acid, lithium, theophylline, cyclosporin, digitoxin, lidocaine, amitriptyline, nortriptyline and impiramine are commonly monitored. Drug information management includes preparation of appraisal, collection, utilization and presentation of information related to the drug. Discharge patient counseling, it in this medication the use of time and discharge of patient will be needed. What are the responsibilities of clinical pharmacist in drug therapy monitoring? While monitoring of drug therapy, it involves the monitoring of drug concentration at specific time, with the intervals. The drug therapy monitoring useful for the drugs with narrow therapeutic window, highly bounded to protein toxic effect of metabolites and likely to interact with other drugs. What are the responsibilities means? Here, clinical pharmacists should design the patient specific drug dosage form and the specific drug dosage remain to improve the drug safety and patient outcome by the considering various factors such as pharmacokinetic and pharmacological properties of the drug product, rational use of the drug therapy and drug therapy in current diseases, measuring of the drug concentration, adjustment of dosage and to monitor the additional responses to the drug therapy, maintaining the records, responsibilities to educate and conduct training programs for the patients and nursing them, responsible to prepare the programs for documentation of patient. A diagnosis is made, which is a drug is selected, and then next dosage schedule is designed to reach the targeted plasma concentration, and then drug is administered into patient. Then the therapeutic value will be find out. I will show a process of reaching dosage decisions with the therapeutic drug monitoring in clinical pharmacy. I will show a pic to you. What is the role of clinical pharmacist in medication chart review? In medication chart review process, the patient who has prescribed medicines by the healthcare professionals. Thus, it is primary responsibility of clinical pharmacists to increase the correctness of medication ordering, transcribing, dispensing medicines, and way of administration of medicines and monitoring of medication for the potential adverse effects and therapeutic effects. Medication chart review has been considered the activities as a strong starting from activities of counseling. The therapeutic drug monitoring and adverse drug reactions, these are the main objectives of the medication chart. To improve the health care outcomes, the clinical pharmacists are better to use. In this clinical pharmacy topic, we have role of clinical pharmacist in clinical review and the role of clinical pharmacist in a hospital and how to intervention the pharmacist. The pharmacist intervention covers wide range of medication related issues. There is necessary a pharmacist intervention to detect any problem with the medication therapy. In patient care service, there are several health issues are there to which is resolved with the appropriate therapeutic regimen. Pharmacists follow the progress therapeutic outcome to review the prescription and need to suggest the patients and their safety, their diet. These are the some points and what and the importance of pharmacist intervention is a major role. It contains sometimes the medication errors can cause the consequences which may range for minor to the seriousness, which leads to death of the patient also. Pharmacist intervention may reduce these problems. Okay, and then role of pharmacist in ward round participation. Role of pharmacist, responsibilities of the pharmacist, medication history and pharmaceutical care, how to care the patient in pharmaceutical way. Some therapeutic goals are there. Thank you for listening the till to this clinical pharmacy will be completed. Thank you for listening and thank you for watching our video. Thanks a lot, and please like, share, subscribe to my channel Pharma Knowledge Hub. Thank you so much for your response. Thank you very much.